Hello, everyone. Welcome back from the break. That was a lot of exciting content this morning, and it actually took a little bit longer than planned. So we're going to do our healthcare piece as planned, but if you're a little late to your lunch meeting, I'll write you a note of apology if that needs to happen. So we're going to talk about healthcare now, and I themed my little 5 minutes here at the beginning, healthcare in living color. And I'll tell you a little story. So my first apartment right after college, me and my roommates would go furniture shopping every Wednesday night. And we'd get in our car and we'd drive around the neighborhood, and we did what you might refer to as garbage picking. And we tried to get furniture and other electronics that sort of matched the aesthetic of the department that we were going for, which was like free collection of stuff. And I remember this was my first TV. It was a black and white TV, and I remember we used to watch The Simpsons all the time. And it did the job, actually. You can follow the characters, you can follow the plot, everything kind of worked. And then one day, I'll never forget, it was probably a few months later when we were out furniture shopping again, we found a color TV. And I'll never forget seeing The Simpsons again, saying, "Oh my God, Marge's hair is blue." And I was like, wow, this is great. It's so vibrant. It's that extra layer of goodness, to everything that I was watching from this point forward. And I think healthcare is like this. It's sort of like being in black and white. It does the job. We see patients. We do surgeries. We work miracles sometime. It's a wonderful environment, but it has its challenges. I'll just pick on one challenge, which we've talked about a little bit throughout the course of this meeting, which is professionals leaving the profession. And you can see the numbers are quite large over the last few years, and it's going to affect all of us. And these are, the frontline clinicians in our industry. So these are some of the most important people in our lives, actually. And to see the kind of burnout and frustration is problematic. And one of the stats that I like the least, actually, is over 50% of physicians do not recommend that occupation to their kids. And I feel like all of us sort of come home at the dining room table talking about how great our professions are and encouraging our kids of their bright future doing something similar. But physicians are not doing that. So this is going to be a generational problem as well. So we've got to think of ways that we can really address sort of, the woes of healthcare right now and have it sort of live in this full living color environment. Because I think we have the opportunities. We have good regulations encouraging interoperability and standards and making life easier for folks to work together. We have networks forming from an interoperability point of view, national networks, great local HIEs, those kinds of things that are really helping with this challenge. We have generative AI, of course, as a great new transformative technology that we can put to the task of making healthcare better. We have partnerships across the ecosystem, payers, providers working together, public health agencies, others, really uniting around taking care of our communities. And of course, passion. No industry has as much passion, I feel, as healthcare for making the world a better place, for enabling all of us to be healthier and lead more productive, enriching lives. So I really feel like we're ready for healthcare to be that full living color environment that we all want. And there are five ingredients, I think, 5 components that I think of from a healthcare and kind of healthcare software point of view. The first is a very positive, modern digital experience for the patient. So healthcare is a little behind service industries, banking, even travel, these kinds of things, in creating that full digital experience. So we need to get there. Second is an enjoyable user experience for the folks that are using the software. So EMRs in particular, other software that we all build can be problematic for users, a little bit clunky, a little bit non-intuitive. And so making that a delightful user experience should be one of our goals, I think. The third is getting value from all the data that we have sort of painstakingly sort of assembled. You know, moving it from beyond just the single patient episode and having a better experience with that patient, but really learning from all that data, learning about public health, learning about trends, learning about which treatments work. I mean, there's really a gold mine there in that data if we know how to get value from it. An ecosystem that works together so that we're all on the same side of the table taking care of our communities, payers, providers, public health, schools, other participants in taking care of our population. And then innovation, fast innovation. So, you know, a quicker way to build applications, to provide value for users to tailor their environments. So these are really the 5 ingredients, and these are going to correspond to 5 demos that we're going to be doing a little bit later this morning.